This presentation is Patient-Centered Medical Home and Specialty Practice Bootcamp Basics and Benefits. Today's presenters are Vance Drakeford and Kristen Gardner, who are Quality Improvement Advisors with the Kentucky REC. And in this presentation, still keep your lines muted. And if you want to ask any questions, you can put them in the chat feature. And we will have some time at the end of this session for those questions. And if we run out of time, we'll make sure to forward those questions to Vance and Kristen to answer them afterwards. Next slide, please. Vance and Kristen are both Ncqa trained PCMH Certified Content Experts, and Vance is the Patient-Centered Medical Home and Patient-Centered Specialty Practice Team Lead. Between the two of them, they have over 8 years of advising experience in patient-centered medical home and specialty practice. Kristen will be starting the presentation. Take it away, Kristen.
Well, thank you, Catherine. And we are so glad you all were able to join us. We do wish we could be in person to see everyone's faces, but this will have to do due to the circumstances we are facing. So my name is Kristen Gardner, as Catherine mentioned, and I'll be kicking off our PCMH and PCSP presentation. So here are just our bootcamp objectives that we would like to cover with you today. So I will provide you with a patient-centered medical home and patient-centered specialty practice program basics. And then I'll pass it over to Vance to talk about the benefits of actually having this recognition and then how the REC can assist you in achieving that. And so let's start off with patient-centered medical home and the PCSP basics. So really, when we're talking about patient-centered medical home, it's not a physical location, but it's more so a model of care that really just emphasizes care coordination and communication, and it really transforms primary care into what patients really do want it to be. And so by following these models of care for both programs, they're really set up as a roadmap, and they provide specific standards for transforming the organization and delivery of your care to be really more comprehensive. And of course, it's centered around the patients. It should provide you better coordination, accessibility for your patients, and is safe. And I do just want to note that there are over 11,500 recognized practices in the United States. So it's a pretty popular program. So first, let me talk about the patient-centered medical home concept areas. So this is for your primary care practices, and then I will cover for your specialty practices. Now they are very, very similar. So for PCMH, you of course have your team-based care and practice organization. The next concept area is knowing and managing your patients. Then we look at your patient-centered access and continuity for care, and then providing care management and support, care coordination and care transitions, and then performance measurement and quality improvement. And then if we're looking at PCSP, the concept areas are basically the exact same, except there is an addition of one, and it's your initial referral management. And I will go through all of these in a little bit more detail in the next slides to give you a feel for what is really encompassed in these areas. So if we're thinking about team-based care and practice organization, this is really where you set up your practice leadership. You would provide some job descriptions and your organizational structure. You would hold patient care team meetings and huddles. And really all huddles are just quick little morning meetings with your staff to discuss patient activities. And then you want to involve your care team in quality improvement. Then you provide orientation to your patients on what PCMH and PCSP really is, and then also making sure that you are on a certified EHR system. And again, as we cover these, this is just, a quick list of what is included. There are other additional areas, but these are the main areas that are really covered in these sections. So if we're looking at knowing and managing your patients, this is where your practice would have a current problem list. You would perform a comprehensive health assessment for all your patients. You would perform depression screenings. You would do some proactive outreach, and this is of your practice choosing. You would make sure to have medication reconciliations completed on your patients and have up-to-date medication lists. And this is where you'd also implement your clinical decision support. And then if we're looking at patient-centered access and continuity, this is where you're really just assessing those patient access needs and preferences. So are you really providing the best access for your patients? Now for PCMH only, you need to provide those same-day appointments. And again, for PCMH, it's providing some appointments outside your business hours. You should also be able to provide that timely clinical advice by phone and documenting that into the patient record. And then having that personal clinician selected for all your patients and really just monitoring how often those patients are really able to see the clinician that they choose. And that is for PCMH only. And then I'm just adding another one at the bottom that is an elective, and this is your patient portal function. So most practices that we've always worked with have the portal set up and have all the functions ready to go. So I just wanted to give you an example of an elective that you could choose to easily get credit for. And then we're looking at care management and support. And so this is where your practice would really sit down and just identify and monitor the patients that they feel would benefit from care management. This is where you would also provide your patients with some care plans and making sure that they actually get a patient copy so they take that home and can review that on their own time. And then should you choose to pursue the additional electives that I've listed here, these are just regarding your care plan. So this is where you're really diving into the care plan a little further into, say, the patient preferences and maybe the goals that the patient has, any barriers to care that they have, and then also developing a self-management plan for the patient to really tackle their goals. And then for PCSP only, this is where you would be identifying patients that are ready to transition back to their PCP. And then care coordination and care transition. So when we think about this concept area, it's really you are performing lab and imaging tests and you're making sure that your practice is tracking, you're flagging, and you're also notifying the patients of those results. And the same goes for your referrals, just making sure that you are tracking those and you really do provide that pertinent patient information. You would want to identify any unplanned hospital admissions and ED visits and making sure that you just share that clinical information with them. You perform post-hospital and ED visit follow-ups for your patients. And here's just another elective that might be useful to some. So you could use some of your clinical protocols and get some elective credit. And then the last concept area for PCMH is performance measurement and quality improvement, and this does apply to PCSP. This is where you choose and monitor those clinical quality measures that you feel really important to your practice. You will also monitor some care coordination measures and any measures that affect your healthcare costs. You'll also want to assess your appointment availability for your patients. You'll monitor any patient feedback. And really, this is where you then set goals and actions to improve those chosen measures. And then if you don't attain improved results, that's okay. But if you do, you can actually get credit for that. And then the last concept area is your initial referral management, and this is only for PCSP. And this is really where you set those expectations with your referring clinicians. You're going to communicate and confirm your referral requests. You'll want to make sure to gather all that necessary information. And additionally, following up with any patients that either missed their appointments or had to cancel. You'll provide response to primary care providers and those referring clinicians, and just making sure that you go back and document with your primary care clinicians. And again, that is just PCSP only. But we wanted to cover those areas so it gave you an idea of what to expect with these programs. And then lastly, I just want to cover the recognition scoring. So how do you really become recognized? So PCMH is on the left-hand side, and you must meet the 40 core criteria in order to receive that recognition. And additionally, you would need to pick 25 elective criteria from 5 of the 6 concept areas. Now, just to put that in perspective, there's over 60 elective criteria that you can choose from. So you have plenty of room to pick what maybe you're already doing or what works best for your practice. And then on the right-hand side is for patient-centered specialty practice. And you would need to meet the 38 core criteria and then 20 elective criteria. And they have a number of elective criteria as well. And you must meet at least 6 or 5 of the 7 concept areas for patient-centered specialty practice. So that kind of concludes my presentation, and I will go ahead and pass it over to Vance to really discuss the benefits of actually going through and pursuing these recognition programs.
Thanks, Kristen. Welcome again, everybody. It's good to be with you all. Kristen did a great job covering all of the different concept areas that go along with both the programs for both PCMH and PCSP. It is a lot of information. Don't let that scare you off. You probably recognize several pieces of those components that you probably are already doing. And that's what we find with many of our practices that go through this journey when they start that transformation process into recognition, that they already do many of these pieces. They just may need to tweak some of the pieces a bit, make some documented processes or policies along the way to get their policies and workflows in a consistent basis. So let's talk about some of the benefits. We've talked about what's entailed into the program. So what can you get out of this? Why would you want to do PCMH or PCSP? Ncqa, they actually did a study about 2 years ago across the country of several different practices and organizations that have PCMH recognition or PCSP recognition, and to see what kind of benefits are available or attributed to this recognition. So let's talk a little bit about the clinical benefits or the health outcomes. As you can see here, being recognized, Ncqa found through their study that many chronic conditions saw improvements. You can see through A1Cs, nephropathy, LDLs, and some diabetic eye exams. Those improvements and percentage changes that they did see over a number of years. And then you can also see on some preventative cancer screenings, they saw some improvements with their breast cancer and also their cervical cancer screenings, saw some increased momentum there, as well as almost 1.7 fewer all-cause hospitalizations. So that's some of the clinical improvements, and there was many more, but that was some of the major clinical improvements that we wanted to share with you. They also saw some patient benefits by being a recognized organization. They found that being recognized, that their patients, at 73% of them actually wanted this type of model of care. So it's very patient-centered, obviously. The patient is more engaged into their actual health and their goals. They have a say-so in their planning. So with that, they saw some improvements in their health, and they felt like it would improve their health. 61% of the patients felt like it would improve their health by having this type of care. And after the study show, actually 83% of patients saw improved health care by being in this type of model. And not only did they see those kind of things, they also saw a greatly increased rate of same-day appointments. So the access improvement of 51% receiving a PCMH care. So that was some other benefits along with that. So now we're kind of moving on into the practice benefits of recognition. So what does the organization receive from having this type of model of care? How does it support your goals for business purposes and those kind of things? Well, they found that by having this recognition, that they had better preventative care, They also saw that increase of access, like I showed you in those same day appointments. There was some increase to that. And also by following up with having extra business hours through the week, they had that increased appointment time for their patients to get in when they needed to. Also, really a big thing for this recognition is they saw a lot of decreased hospitalizations and ER visits by having this type of care. And I can probably name almost 100% of the practices I've worked with over the past several years that say by doing this, their efficiency and their workflows become so much more consistent, and everybody's on the same page. Everybody knows exactly what the process is, that it's all working together, and it's just, that's been one of the biggest improvements that we have seen working with clients, that they really notice how everybody comes together and really has a more of an efficient workflow. And by doing all these things and involving that patient, I mentioned, having that higher patient engagement. When the patient becomes involved in their own care and they have a say-so in that's important to them, what their health goals are, those types of things, that patient will become engaged and become more apt to do the things that they should do to take care of their own health and see those improvements. So these are some of just the practice benefits that we see as well. Now, as we move on, what does the staff get out of it? Because with this type of recognition and transformation, there is work that goes with it. Even though you may be doing it, it's not an easy task, but with it, there are benefits for the staff. They all become more engaged with one another. Like I said, they become consistent, and they understand why they're doing it. They have a singular purpose of meeting this recognition, and that the patients are focused around their care, and that's the utmost goal for this program. And the providers become more engaged as well as the employees. At first, like I said, there's some hurdles to jump and maybe some different workflows that you have to tweak. So that can be aggravating at times. But once that is figured out and everybody works together to form that new workflow, really things, like I said, become more efficient, and it makes things work life a lot more easier, and it makes people happier, and things seem to flow a lot better by having that streamlined, formalized process and doing that. And as Kristen mentioned earlier about having that daily huddle, that really helps things too, and really focuses in on that patient care and what's important for the patient that day and what your goals are for that visit for the patient. So what are some financial benefits of recognition? Well, they have seen in that study, they found that there was more office visits than in non-PCMH clinics. As you can see, they saw an average of 163 more office visits, lower acute care hospital spending of 62%. And what I found really interesting and really great is the average per patient total Medicare spending. And that was over a study of over 190,000 different beneficiaries in a PCMH model, that it was almost $1,100 lower per total Medicare spending. That's, to me, incredible. Also, with the reduction in ED utilization, almost $5 million in savings per year. When you start really doing those efficiencies, those care planning and care manage with your chronic patient populations, and having that access for those patients, that's really going to give some help to get those patients into your office as opposed to just going to the ER, and keeping those A1Cs down and blood pressures down and those kind of things. And also that reduction of 10.3% in ambulatory care sensitive inpatient admissions. So really some good financial benefits that you see from this. And as you move on, some other financial benefits. Humana has a medical home program. They shared this with us during a conference last summer, less than a year ago. about their Humana medical home program. So these are any practices that are recognized as a patient-centered medical home or seeking recognition actively from some sort of accrediting PCMH agency. You can get some financial benefit. Now, there's some stipulations. You have to have more than 250 Humana-covered patients so you can participate in the program, and you have to be in an agreement. And it is in an individual contract basis only with Humana. So this is something that's really important. You've got to speak to your payer as you're making your contract negotiations and determine how this is going to fit into your contract and how that works, and find those financial benefits and those quarterly bonuses and how to reach those. So make sure if you have recognition or you're considering it, that when you're making those negotiation contracts, this is really important that you talk to not just Humana, but other payers that may have similar programs available as well. And now also, most of us, I'm sure, following the quality payment program and submit for the MIPS track. And if you do, being a patient-centered medical home or specialty practice, a recognized practice, you can get full improvement activities category credit. So if you submit as an individual and you're in a PCMH model, then you can get full category credit for improvement activities. Or if you submit as a group, you still can too. You just have to make sure that you have at least 50% or more of your clinicians participating or be recognized as PCMH. Also, with PCMH and PCSP, it really lays that foundation for that value-based model preparation. With that higher quality of disease management, those comorbidities planning, and patient care populations, focusing on that, you can really see how this narrows in and helps with that value-based model preparation for that. And as you're preparing for that value-based model, it's also preparing for that advanced payment model, which is very similar, one and the same basically, but it lays that foundation as you have that care management, your care coordination, your quality improvement is embedded. And those are all the things that you need to do to be in an advanced payment model. So becoming PCMH recognized or PCSP recognized really lays that foundation to get into that model that CMS is really striving for everybody to eventually be into and to follow that advanced payment model. So we've talked about, the program requirements. We've talked about the benefits. How can we help you guys? So what we do with assistance, if you do seek our assistance, we are a trusted advisor, partner in quality with Ncqa. So that allows you to get a discount towards your initial recognition fees with Ncqa. You also would be assigned a personalized advisor. We are all on this service line, PCMH Certified Content Experts. We're going to help you with some gap analysis, provide education on the different concept areas, some tips and tricks of how to meet those, some electives that are probably already being done at your organization. We can help you find that and help you to do that as well, to get that roadmap into recognition. So something a little bit different this year, and we're excited about it, is a new contract option. So a lot of practices that we've helped may not be completely ready for recognition, or they don't want to get recognition, but they need some help in some areas that are really embedded within the PCMH or PCSP programs. So we are starting a new contract. It's an individualized basis that we can kind of personalize this for your organization or your practice to maybe receive assistance, maybe if you're looking for quality improvement assistance, really kind of walk you through that track or concept area of the program and get you prepared for that, to really embed quality improvement within your practice so you're on the right road with that. Maybe you want help with care management and care planning. How do you put that and implement that into your practice and get that going so you can be prepared and have a better care management program, or care referrals coordination. We can help out with that as well. So we're excited about that. So if you have questions, please reach out to us, and we'll be glad to answer any questions for you. So we've been doing this for a while, helping people get PCMH and PCSP recognition. We have assisted over 130 practices towards recognition, and of those that have submitted, 100% of those have received recognition through Ncqa. So we're really proud of that. Our practices work really hard, and they've done a great job, and I think that they've seen a lot of benefits from doing this hard work. Now, if you're interested, if you're trying to decide if you may be ready for this journey, we do have a readiness assessment. It's a free assessment. You can go to our website and go to our PCMH section of our website, and we'll be happy to help you find that if you need help. And take that, and we can review that to see how ready you are for this. If this is something you may need some more work on, or et cetera, we'll be happy to assess that and get some feedback for you. So that really brings us to the end of our boot camp. It's probably the easiest boot camp anybody could ever do, right? Thanks for joining us. We'll take any questions if you guys have that. We have not a lot of time, but maybe a minute or two, Catherine. We'll be happy to, Kristen and I'll answer any questions if there are any.
All right, well, I have a common question that people ask a lot. It is, how long does the PCMH PCSP preparation and submission process normally take?
I can answer that for us. So typically we really just tell our practices anywhere between 6 months to a year. And it kind of depends on, you know, do you have a team that you can kind of dedicate to working on this? Or if maybe somebody will be probably working on it maybe a little bit more solo. And that's really what Ncqa has said too, you know, give yourself about six months to a year to really get through that recognition process.
Okay, great, thanks. I've got one more, since we just have a little bit of time. What are the biggest challenges to achieving Ncqa recognition?
I'll take that. The biggest challenges, well, I think it's different for every organization depending on where you are on your journey, basically. I think one of the biggest things that comes to my mind is people tend to get in their own mind and kind of make it more difficult than it needs to be. And maybe try to make it something that Ncqa's requirements are, make their practice Ncqa. But that's not their purpose or their intention. They really want you to have your own practice and focus on your own patient population. That's what's important, okay? So they want you to make it how it fits for you. Take those requirements and fit it into your organization. So I think that's a big hurdle, is trying to not let, you know, the requirements get the best of you and not make it as hard as you think it is. But I think the other biggest thing that we hear all the time is, oh, we do all of this stuff, I think. We're already doing this. We just need to write a documented process or a policy. And they end up having just to take what they're already doing and put it on in black and white on paper. So that's probably one of the biggest challenges too.
Okay, thank you so much for answering those questions. And thank you, Vance and Kristen, for sharing this really important avenue of quality improvement with our webinar participants today. And if you have any questions, think of them. Feel free to email us at kyrec@uky.edu. You can call our phone number. It'll just be answered a little bit late this week because of the week of webinars, and that's 859-323-3090.